Assalamu alaikum, peace be upon you. Welcome back. You are listening to the Mara Mukonda Show. Hope you are having a fantastic Tuesday, the 1st of December 2020. Right, it's time for our Women's Health Tuesday, and today we are tackling a difficult to pronounce. It's adeno, adenomyosis. Right. This difficult to pronounce word is something that affects the uterus, and we're going to be learning more about it with our resident specialist, obstetrician and gynecologist, Dr. Tom Mokaya. Good afternoon, Dr. Tom.
Dear listeners, good afternoon.
How are you today, Doctor?
No, I'm good. I hope you're doing good too.
All well, thank you. Now, what is this difficult to pronounce condition, adenomyosis?
Now, this difficult word to pronounce called adenomyosis is a terminology that is used when the lining of the womb, to take you back a second, so I can give you a picture of the area that we're dealing with. The uterus has two layers. There is the inner layer, which I always call a carpet. That is the one that grows, and then when you have a period, it bleeds and goes and then gets smaller and then grows. So it keeps growing and getting smaller every month. That changes theoretically every month. And then you have the layer outside, which is the thin layer, which is a muscular layer. That one remains there permanently. Now, adenomyosis, when you have the lining of the womb, that carpet, which we call the endometrial, where for some reason we find that it slowly permeates into the lining of the womb. The lining of the womb goes into the wall of the womb. Just that if you imagine the paint that is on a wall, suddenly some of that paint gets its way into the bricks. Now, when it goes into the bricks, it can go there and with time gets bigger and bigger. So essentially, adenomyosis is when the lining of the womb, the inner lining of the womb is found in the wall or the muscular layer of the womb. And
now, what causes it?
Now, the cause of adenomyosis is not really known. And there are many theories that have come up that it could occur when the womb is being developed, when the baby is inside the womb, or it can occur during surgery, or it can occur through a system where we don't know where that lining for some reason migrates into the womb and stays there and can live there and stay, and it does not give any problem. And according to statistics that we know, it is postulated that around 8 to 30% of women have this condition called adenomyosis. But fortunately, not all of them will have symptoms of adenomyosis.
Now, if that percentage of women will get it, is there a specific age group who are more at risk and should be concerned?
Now, adenomyosis normally tends to get it in what we call as the middle age. A woman who is in the middle age. The middle age is a big difference. So anything from theoretically from around 25 up to menopause, up to 50 or 55. Those are most of the time the women who we find have adenomyosis. We rarely find it in younger girls who are in their teens. Most probably because there has not been enough time for that lining of the womb to move from the way to the wall of the womb. So typically we see it in middle-aged women.
All right. And can one fall pregnant if they have adenomyosis?
Yes, one can fall pregnant when they have adenomyosis. Just like any disease, there is a
Yeah.
degree of adenomyosis. There are instances where there is mild to moderate adenomyosis.
Mm.
And when there is mild to moderate adenomyosis, one can fall pregnant. And some women don't even know that they have adenomyosis. They fall pregnant, they carry the pregnancy to 9 months and give birth and fall pregnant again. However, if the adenomyosis is widespread and it's quite big as it were, then it might cause some women struggle to fall pregnant because it makes the womb very big and it also may affect the lining of the womb. So some women may struggle to fall pregnant if the adenomyosis is very, very severe. Because at times the adenomyosis can grow so big in the wall of the womb that it blocks the fallopian tube. And of course, if the fallopian tubes are blocked, one may not be able to fall pregnant.
Mm-hmm. How different is it from endometriosis?
Now, after we make the diagnosis of um, adenomyosis, the differential or the other thing that also presents the same way is endometriosis. And it's a good question that you ask because endometriosis is when we find the same lining that we've been talking about, where it migrates into the rest of the abdomen, in the rest of the pelvis. So that's a good question because endometriosis and adenomyosis are cousins, as it were, where we find the lining of the womb going in the wrong place. So endometriosis is when we find the lining of the womb in other places other than in the wall of the womb. So it can be inside the lining of the womb. It can be found in the ovaries. It can be found on the lining of the tube. Or it can even be found in the abdomen or even in the stomach. And the symptoms are almost the same, where one will experience, very severe period pains, um, and they may struggle to fall pregnant, or they may bleed a lot when they're having adenomyosis.
Oh, very interesting. And can it spread? So, if it's within the uterus, can it spread to other organs, or does it just remain around the womb and that area?
Good question. It can only, when it's the classical definition of adenomyosis is when the endometrial tissue or the endometrial cells or the lining of the womb cells are in the lining of the womb. When now it moves to other organs, now it's called endometriosis, as you asked before. So when it's in the other side of in the other parts of the body, then it's endometriosis. But
Mm-hmm.
adenomyosis specifically stays inside the wall of the womb, in the myometrium, as we call it.
Mm-hmm. And how is it diagnosed?
Now, the diagnosis is normally when you make a diagnosis, we start a diagnosis by the history. So the patient will come complaining of typically two or three things. They'll come and say, my periods are heavy. I bleed a lot during my periods, or I bleed for a prolonged period of time. And the other complaint is when I bleed, I'm in severe pain. And most of the time, this pain goes away after the period gets finished. The times some may complain of feeling that they can feel their uterus because the uterus is enlarged. So classically, those are the symptoms that the patient is complaining with. Now, after the history will examine, and one may find a uterus which is enlarged, much bigger than what you expect. And then on ultrasound, which is what we use for the diagnosis, one can be able to see some classical features of an enlarged womb with diffuse enlargement, which one has to be careful not to confuse it with a fibroid. And then in a case where we can't really go to the diagnosis, we use what we call an MRI, which is much more sensitive than ultrasound to be able to delineate exactly where the adenomyosis is.
Mm-hmm. Now, Doctor, earlier on you mentioned about, it comes to women in their mid ages from around 25 up to menopause. So if somebody did not previously present with any health complications, can they, adenomyosis still come? Can they still get it?
They can still get it. And the way we say that they still get it, they may have been having it in their late 30s or early 40s, but it never gave them any symptoms. So they don't know that it's there. However, adenomyosis can start at any age in any woman who is childbearing, which means any woman who is having periods can develop adenomyosis. So it could even start in the late 30s or the late 40s. It can start at any stage in the woman menstrual cycle period.
And how is it cured?
Now, the treatment can be very tricky. It depends on whether the woman wants to have a family or does not want to have a family. Most of the time, when we get patients who want to have a family, then or they don't want to have a family immediately, then we try managing it. If it's pain, we use painkillers, we use oral contraceptives. Although there are some research researchers who say that when you use oral contraceptives, that will make the adenomyosis worse. However, it can control the pain. Now, the other way of treating it is to make the woman medically menopausal, where we give something called GnRH analog. So you give that drug, which makes the woman not menstruate. The advantage is once you stop taking that medication, the periods come back and she can have a period. So we use GnRH analog to stop the periods and therefore make the lining of that, wherever it is, smaller. The other way of managing it is by surgery. In surgery, because it's a swelling in the womb, when we do surgery, we do what we call a skinning myomectomy, where we open up and try and delineate and take out those adenomas. But if somebody who has finished their family and they still don't want to have any children, the ultimate treatment is to take the uterus out.
Mm-hmm. All right. Is it hereditary? Can it be passed from mothers to to their daughters, grandmothers, etc.?
Good question. Just like fibroids, which are also cousins to adenomyosis, we find that they run in families. It means that you may find that, oh no, my mother also used to have that when you're taking the history. So you might find that the mother who also had the gene. So we tend to think that there's a gene which is passed from a mom to her daughter. If the mama, so it is true that in some instances it can be genetic, yet in some instances it's spontaneous, which means it occurs with no family history.
Mm-hmm. And are there any risk factors associated with it?
Now, the main risk factors that are associated with adenomyosis is that one may struggle to fall pregnant, but there's nothing that one does that if you do, then you are more likely to get adenomyosis. So the risk factors have not clearly been identified. So there's none that one can be able to say these are the risk factors that predispose you to getting adenomyosis.
Mm-hmm. All right. So thank you so much for your time, Doctor, and have a wonderful day.
Thank you. Thank you so much for having me.
Pleasure.
Yeah,
Right. That was Dr. Tom Mokaya, OBGYN from Netcare Hospital, taking us through adenomyosis, a condition which can affect women from around ages 25 right up to menopause. And as Doctor mentioned, that you might not know that you have adenomyosis because, I mean, the symptoms might not be present and it only becomes present in your uh, later ages, maybe around your late 30s into your 40s, etc. It is a very painful condition, so do go and get yourself checked out. And if you are bleeding, because I read somewhere that um, while you are on your menstrual cycle and you are bleeding, then these like blood clots of adenomyosis also tends to bleed, and you'll be bleeding. The adenomyosis will be bleeding, and you'll have like just a heavy flow that was not previously there. So do go and get yourself checked out for such conditions. And it is painful, as I mentioned. It could be as painful as endometriosis. So you obviously pain it's unbearable. Menstrual pain, period pains, it's not something that is fun and hip hip hooray, I'm going to just pop a pill and I'll be okay. No, it's not always the case. For some people, yes, but not for everyone. In fact, I know a lot of women who go through terrible menstrual cramps, and sometimes it just gets better after childbirth. But anyways, if you're experiencing such pains and you are within the age groups, do go and get yourself checked out. Dr. Tom is based at a Netcare hospital in Sandton. Right, and also it could be hereditary, it could be genetic if your parents, your mom rather, or your grandma or her mothers, yeah, if they had presented with adenomyosis, then it would be necessary for you to go and get yourself checked out. For further comments, questions, queries, or suggestions, please leave them in the comment section, or you can send them to us on WhatsApp. The number is 061 766 0355. We will be right back.